Hello, my name is Ambrielle Turner. In this video, I'll be demonstrating central line dressing change. First, I'm going to verify my physician's orders and gather my supplies. I'm going to identify my patient by having them state their name and date of birth and checking it with the armband. I'm going to perform hand hygiene, don clean gloves, and a surgical mask. If my client is unable to turn their neck away from the catheter site, I'm going to put a surgical mask on them as well. I'm going to start the procedure by gently removing the old dressing and the old bio patch if it's present. I will gently remove the old dressing by pulling the dressing off towards the catheter, being sure not to dislodge it. I'm going to properly dispose of this old dressing, remove my gloves, perform hand hygiene, and prepare to set up my sterile field. Grabbing only the 1-inch border of the drape, I'm going to set up my sterile field. Now I will pour the contents from my sterile dressing change tray onto my sterile field and dispose. Now I will don my sterile gloves. Prior to cleaning the skin of the site, I'm going to assess it. I'm going to be assessing the site for redness, bleeding, drainage, or any signs and symptoms of infection. Once I know that there are none of those present, I'm going to go ahead and begin the cleaning process. My gloves are sterile. I'm still sterile. I'm going to manipulate my sterile field to make it closer. Now I'm going to begin cleaning. I'm going to use what's in the kit to clean, or you can use whatever per facility protocol. But at this time, I have ChloraPrep. So I'll be cleaning horizontally from left to right, vertically up and down, and in a circular motion at the site. I'm going to dispose of that. I'm going to allow it to air dry. After it dries, I can go ahead and apply a bio patch if one is present. At this time, we don't have one present, so I'll just go ahead and apply the Tegaderm. I'm going to remove the paper backing. And apply the Tegaderm to the skin. You can use your hand to apply some heat because it sticks better if you apply a little bit of heat to it. I then will label it with my initials, the time and the date. I would then remove my gloves, perform hand hygiene, document the procedure, document the appearance of the site, and document the patient's response. I would definitely perform hand hygiene and clean up my area and dispose of this in a proper disposal. Thank you.